This conference will now be recorded.
We now move on to the next topic in the syllabus of chemotherapeutic agents. And this time what we are seeing is sulfonamides. So basically sulfonamides are azodides. If you remember, you have done a test, confirmatory test for primary amines, especially aniline, where you used this test which involves the formation of azodides. So these azodides, they contain the amine or the amide group, and when they have an amide or amide group, if it is an amide group, it breaks down to an amine group and gives this test positive, the azodide test. And the primary requirement and mandatory rather requirement of the azodide test, if you recollect, is you have to maintain the temperature in the ice bath between 0 to 4 degrees centigrade. Only then you get the orange dye, orange azo dye of aniline. Okay, so these sulfonamides are also azo dyes which are easily obtained. They can be used as staining agents also, because they have a typical dye color or an orangish yellowish color which they impart to different substances. Now, the first drug from these sulfonamides which was discovered to be having antibacterial activity or chemotherapeutic activity was prontosil. Okay. Now, in vitro prontosil, which is a sulfonamide or a sulfonyl amide, is not having activity, but when it is in an in vivo condition, it is having good or rather very good, I should say, activity against bacterial agents, especially against streptococcal infections. And then from this prontosil, a large number of other sulfonamides were synthesized, or they were discovered, and all these sulfonylamides had good or they have good antibacterial property or antibacterial activity, and they are widely used in different types of infections, right from urinary tract infections to cerebral toxoplasmosis. Then when our regular antibiotics are of no use, then also you can use these sulfonylamides or sulfonamides in burn therapy. That means when a patient is recovering from burn wounds, sulfonamides are the most preferred class of chemotherapeutic agents. So these sulfonamides are nothing but aniline substituted sulfonyl amides, and they are prodrugs which in vivo produce sulfonyl and they have chemotherapeutic action, or they have antibiotic action. Now it is this category of drugs, or this class of drugs, sulfonamides, some compounds of them have also shown anti-diabetic activity. If you recollect, one of the examples or one of the classes of anti-diabetic agents that we studied contained the example of tolbutamide. Tolbutamide belongs to the class of sulfonamides, and along with having antibacterial activity, it also shows anti-diabetic activity. So when tolbutamide was first used only for its antibacterial property, it was that time discovered that it is showing anti-diabetic property as well. So the use of tolbutamide shifted more towards it being used as an anti-diabetic drug than being used as a antibacterial agent. Similarly, a drug which is having diuretic activity and which is similar in structure to sulfonylamides is furosemide. Partially furosemide structurally is similar to sulfonamides, and along with having antibacterial properties, it has also shown it has also shown diuretic action. Okay, now one major care that you need to take when a patient is being prescribed with sulfonamides or sulfonamides, or what they are majorly called as sulfa drugs, is the patient should not be having any allergy to this sulfa drugs. There are many patients who are like, there are patients who are allergic to penicillin, there are patients who are allergic to these sulfur drugs. The most characteristic feature of these sulfur drugs is that they are yellowish in color. They look like turmeric, or they have a very lighter yellow color like turmeric. And many patients or many individuals have sulfur drug allergic reactions. So when a doctor or a pharmacist is prescribing sulfonamides or sulfur drugs for its antibacterial property in the patient, care has to be taken that the patient is not allergic to this class of antibacterial agents. One specialty that we should mention about this class is that it is very pH specific. It has a very pH specific activity. If you are using sulfonamide drugs for the treatment of urinary tract infection, in general, the pH of urine is towards acidic. Okay, it is usually 6. And when there is an infection condition, when there is a urinary tract infection, the pH falls further. It goes below to 4.5 because of the presence of bacteria. The bacteria is flourishing or thriving in that acidic pH. So if you are going to use sulfonamide type of drugs or antibacterial agents for the treatment of urinary tract infection, you have to ensure that the pH of the urine is increased. Okay, so there are certain alkalizers which are obtained, which are available. Like there is an alkalizer which is very commonly used in the treatment of urinary tract infection, which is called as Cital. So Cital is an alkalizer, and when you take this alkalizer, the pH of the body and in general of urine starts increasing. So the reason, there are two reasons why this pH change in the urine should be brought about. Number one is the organisms which are causing urinary tract infections, they flourish or they grow or they thrive very nicely at a lower pH. So if you use an alkalizer to increase the pH of the pH of the body, or in general pH of the urine, then automatically the flora which is causing the urinary tract infection, it is not going to survive, it is going to die. So this is one advantage. The second advantage, or the second use you can say, as to why you need to use an alkalizer like Cital, especially when you are using sulfonamides for the treatment of urinary tract infection, is like I told you, these drugs are active at an alkaline pH. You will not see activity at a pH below 7 or even at 7. So at an alkaline pH, you will see that these drugs become water soluble, they show good antibacterial activity, and most important, the excretion of the drug from the body becomes easy. Now, if the pH of the urine is not maintained to its alkaline pH, or it is lower, that it is in an acidic pH, what is going to happen is crystals of these sulfur drugs are going to get deposited in the kidneys, and further there is going to be development of kidney stones. Okay, and you know kidney stones are very dangerous. So if you don't want this crystalluria or the formation of crystals of sulfonamide drugs or sulfur drugs to happen, then you need to use alkalizers and you need to maintain the pH in an alkaline state. So at what pH? Preferably 10.4. Okay, that is the pH at which it is desired that the urine pH is maintained, so that they give good antibacterial action. So this is one feature that you should remember about uh, sulfonamides or sulfur drugs when you are prescribing them to any patient, especially in the treatment of urinary tract infection. Now, in general, also it can happen that you are probably suffering from a respiratory tract infection, or there is some other infection, that bacterial infection, that you want to use sulfonamide for. In that case, also you need to ensure that crystalluria formation in the kidneys is not happening. The crystals of sulfur are not getting formed and deposited in the kidneys. which you can maintain by which you can do by maintaining the pH of the urine at an alkaline pH of 10.4 and above. So this is these are the two points of care that you have to take when you are prescribing a patient with sulfonamide or sulfonamide drugs. One is an allergic reaction to sulfonamides, which is a very high probability, and the second is the pH of the urine has to be maintained. Otherwise, the excretion of the drug from the body will get difficult, and there will be development of crystalluria or stones in the kidneys because of these sulfonamides. Okay, so we now move on to the mechanism of action of the drug. Before that, we'll see a very important biosynthetic procedure that happens in our body. So here what you see on your screen is guanosine, which is a nucleotide or a nucleic acid base, which is going to help in the formation of DNA. So other than having a role in formation of DNA, guanosine is also having other different roles. That is, it is helping in the formation of folic acid also. Now, when the folic acid has to be formed, it requires a substance which is called as PABA. PABA stands for para-amino benzoic acid. Okay, so this PABA, which is obtained from pteridine diphosphate, in pteridine diphosphate in the presence of PABA and the dihydropteroate synthetase enzyme is getting converted to dihydroteroic acid. Then this dihydroteroic acid is forming folic acid. Further, when the DNA construction has to happen, the folic acid needs to be in a particular form. So this folic acid is converted to dihydrofolic acid, and this dihydrofolic acid is converted to tetrahydrofolic acid. So you see over here, there are steps which are involved in the formation of tetrahydrofolic acid, which is going to form the base for DNA and RNA synthesis. And especially in pregnant women, folic acid deficiency should not be there. Otherwise, the child is born with a defect called as spinia bifida. So this tetrahydrofolic acid has a major role in DNA building activity. For the formation of this tetrahydrofolic acid, you require number one, PABA, number two, dihydropteroate synthetase enzyme should be present, and number three, dihydrofolate reductase enzyme should be present. Okay. Now, already I have marked over here the name of the drug which is acting at these particular sites. Like for example, PABA or dihydroteroate synthetase, both of them are inhibited, or their activity is going to be inhibited by the sulfonamide drugs. Okay, so the conversion of pteridine diphosphate to dihydroteroic acid is which has to take place, and which requires the presence of PABA as well as dihydroteroate synthetase enzyme. This action will be inhibited when you use sulfones and sulfonamides or sulfonamides as antibacterial agents. Similarly, the further reaction, that is conversion of dihydrofolic acid, which is obtained from folic acid, this dihydrofolic acid has to be converted to tetrahydrofolic acid, and for this it requires the presence of dihydrofolate reductase enzyme. This enzyme activity is inhibited by the drug trimethoprim. Okay, so this trimethoprim also is an example of sulfonilamide class of antibacterial agents, and by inhibiting the activity of this dihydrofolate reductase enzyme, this dihydrofolic acid will not be converted to tetrahydrofolic acid. Now these reactions or these actions are specific to bacterial cells. Okay, all this conversion, the requirement of PABA, all these reactions which I have told you, these are restricted to bacterial cells. To some extent, yes, you do require folic acid, you do require PABA in human cells also, but the sulfonamide drugs are specific in action or they are selective in their action, they are more inclined towards binding and inhibiting the action of PABA and the dihydropteroid synthetase enzyme in bacterial cells than they would be inhibiting the action of PABA in the human cell. The same thing stands for dihydrofolate reductase enzyme. It would be more inclined to inhibit the activity of dihydrofolate reductase enzyme, stop the conversion of dihydrofolic acid to tetrahydrofolic acid, which is then going to go and join the glutamine, which is then guanosine, sorry, and build up the DNA structure. Okay, so this research or this background was there in the mind of the scientists, and based on this the drugs of sulfonamides or sulfonamides have been designed. So you have PABA and you have the parent compound prontosil, which is not completely but at least 90% structurally similar to the PABA structure. So instead of PABA, prontosil will take the place of PABA, and the required action of forming dihydropteroic acid will be inhibited, thus inhibiting DNA and RNA synthesis. So this is exactly what is the mechanism of action of the sulfonamides or sulfonyl We have already covered all this. We just now discussed about the mechanism of action. They are PABA inhibitors. PABA is required to produce dihydropteroic acid. Synergistic action of sulfonamides and folate reductase inhibitors, that is trimethoprim, which are going to inhibit the dihydrofolic acid to get converted to tetrahydrofluoric acid. Both of them can be used together for the treatment of different types of infections, bacterial infections. In fact, sulfamethoxazole and trimethoprim is available as an antibacterial combination in the market. It is called as Septran, and it is the most commonly used antibacterial drug, especially in kids who are suffering from urinary tract infections. Okay, so this is the short form of the cycle that I showed you previously. PABA is required to convert dihydropteroic acid to form dihydropteroic acid, and PABA is also, or rather DHF reductase, dihydrofolate reductase enzyme is required to form tetrahydrofolic acid. In general, all these steps are required for the formation of these nucleic acids. So if these steps are inhibited, nucleic acid synthesis will not happen. If nucleic acid synthesis does not happen, then you are not going to have the bacteria from multiplying, and there will be death of the bacterial cells. Eventually infection shall reduce. Now what you see on your screen is the parent compound from which different types of um, sulfonamides or sulfonylamide drugs have been designed. So this is the parent compound, where on position number 4 you have the amine group NH2. Position number 1 you specifically have the sulfur group or the SO2 group, and to this there is again one more nitrogen attached, and this is how the numbering is done. So there are two nitrogens which are present. One is at position 1, other is at position 4. The position 4 nitrogen is a part of the amine group, and the position 1 nitrogen is attached to SO2. So we come to the SAR of this class of sulfonamide antibacterial agents. The first point is that this N1 which you see, it should be acidic in nature. Okay, then the amine group and the sulfonyl group both are essential for activity. This is the amine group, this is the sulfonyl group, and this is the benzene ring. So all these three things, the benzene ring, the amine group and the sulfonyl group, all three are essential to show antibacterial activity. In fact, they should only be at this position. There should be no shifting. That is, amine group should be at position 4, sulfonyl group should be at position 1 to give good antibacterial action. If you replace this benzene ring with other heterocyclic ring compounds or other aromatic rings, there is going to be loss of antibacterial activity. You could try, however, you could try heterocyclic nuclei in this case, and it could show increased drug action, or it could give drugs which are more potent than sulfonyl amides. If you reduce this SO2NH group here to CONH, okay, if you replace this SO2NH group with CONH, there is going to be decrease in activity. Similarly, if this second nitrogen which is present in the amine group at 4th position, if you replace this with NHCOCH3, that means with an amide, you are converting amine to amide, then the activity remains same. This is in fact the baseline for the formation of prodrugs, where you are actually converting this amine group to an amide group, you are making its prodrug, and in vivo this amide group breaks down to release the amine group. The entire structure of sulfonylamide is released, and once that is released, it is going to show the normal antibacterial activity. Yes, don't forget the pH part, that is also important for activity. Now, based on their duration of action, okay, like short acting, intermediate acting, and long acting, that means how many hours of activity the sulfonamide class of drugs has shown. They are classified as short acting, which shows activity for around 6 to 9 hours, and the examples are sulfodiazine, sulfamethasone, and sulfioxazole, sulfacetamide. Sulfacetamide in fact is used as eye drops in different types of eye infections. Then you have intermediate acting drug like self-methoxazole, which is showing activity for good activity for around 10 to 12 hours. And the other is the long acting agents like sulfadoxime. Sulfadoxime has 24 hours of activity. Okay. Now this is the classification based on duration of action. You can classify the sulfonamide class of antibacterial agents based on their site of action, that is their use. Like I told you, most of the sulfonamide drugs are used for curing burn wounds. Now, burn wounds which are superficial are fine, where you just get a burn spot on your skin. But often we see, due to burst of gas cylinders or other reasons, there is excessive burning, 40%, 50%, 90% burnt patient get admitted into hospitals, and for them this class of agents is a boon. It is maximum used for treating burn wounds. So they could be topically applied, or they could be used for eye infections, like for example sulfacetamide. You could use sulfacetamide both topically as well as in ophthalmological infections. Then you could use a drug like sulfaguanidine for GI infections. So based on their site of action, for GI infections, you have sulfaguanidine. To prevent UTI infections or to treat UTI infections, you have sulfioxazole. To treat meningitis, you have sulfadiazine. To treat respiratory tract infections, you have cotrimoxazole. And one drug, anti-leprotic, which belongs to the class of anti-leprotic agents, is dapsone, which also is a sulfonamide, and this falls in the category of drugs used to treat leprosy, that is dapsone. Then for bowel infections, or what is called as inflammatory bowel disease, you have sulfasalazine. Okay, so all these drugs, the structure of all these drugs is visible on your screen, and I have already enumerated the use of these different types of drugs while I was telling the classes. So there are two types of classifications, one based on action, the other based on the site of action, like topically applied, GI infection, then respiratory tract infection, bowel infection, meningitis, urinary tract infection. These are some of the uses, and there are some specific sulfonamides that are used for the treatment of these different sites of infection. We have already seen the mechanism of action. We now come to the synthesis part of um, various sulfanilamide drugs. Like for example, what you see on your screen now is the synthesis of dapsone, followed by synthesis of trimethoprim, which is synthesized from 3,4,5 trimethoxybenzaldehyde. The synthesis of trimethoprim is on your screen, and it is in the end giving the trimethoprim drug, which is a sulfonamide drug and which is used in the treatment of urinary tract infection. Then you have the synthesis of sulfacetamide. This is the synthesis of sulfacetamide. Okay, so with this we complete the topic of sulfonamides, a very simple and a easy topic which is included for your exam.